This lecture is going to examine some of the treatment approaches for bipolar disorder. Remember, of course, bipolar disorder is two moods, sadness or classical depression, followed by bouts of mania. Historically, bipolar disorder was discussed in Dr. Jekyll and Mr. Hyde in the 1880s. Vincent van Gogh, the artist, was suspected of having bipolar disorder. Some of more recent movies, such as The Silver Linings Playbook, starring Bradley Cooper and Jennifer Lawrence, had one of the main characters as being suffering from bipolar disorder, and also in the TV series Homeland, the main character suffered from bipolar disorder. There are several drugs that are used to treat bipolar disorder. The first-line therapy includes valproic acid to basically initiate stabilization, as well as lithium to maintain some of the changes in mood that can occur. Also shown to be quite effective is quetiapine, the antipsychotic, with lithium maintenance therapy. Second-line drugs are all listed here, including antipsychotic quetiapine and the anti-epileptic lamotrigine. Third-line drugs and other options are listed here as well. Remember, the antipsychotics listed here, quetiapine, aripiprazole, olanzapine, risperidone, as well as treatment for epilepsy, carbamazepine, which is also known as a mood stabilizer because it does affect both serotonin and norepinephrine. Valproic acid and lamotrigine were already discussed. Lithium has several mechanisms of action. It does promote GABA. Remember, GABA is an inhibitory neurotransmitter, and it also inhibits both dopamine and glutamate activity. And remember, these are both excitatory neurotransmitters. And it does so at various receptors, including G protein coupled receptors associated with the dopamine receptor, the NMDA receptor associated with the glutamate neurotransmitter, as well as the GABA receptor. Lithium side effects are notorious. It does have a narrow therapeutic index, and toxicity can quickly develop. Remember, drugs that have a narrow therapeutic index basically exist in a very, very tightly controlled dosing world where a little bit extra drug can produce toxicity and a little less drug can produce under therapy. This drug is unique in that it's excreted in the sweat. And ironically, it cannot cross the blood-brain barrier, as well as other cations such as sodium or potassium. But changes to blood-brain barrier permeability actually affect the drug absorption relatively quickly. So things like an acute alcohol ingestion, which is known to affect blood-brain barrier permeability, believe it or not, can dramatically increase lithium levels in the CNS and produce toxicity very quickly. Also, acute dehydration, heavy exercise, a GI viral infection, an overdose of a diuretic, anything that leads to acute volume loss that's very quick can dramatically shift plasma levels and favor a lithium toxicity. So lithium is, when dosed properly, works very well, but very problematic in terms of managing patients on long-term lithium therapy.